Hello everyone. In this part we will learn about the CNS depressants, and in the first part we will learn about the alcohol, that is ethanol or ethyl alcohol. Okay. Now first we will classify how the systemic poisons work. Okay. There are cerebral poisons, spinal poisons, peripheral poisons, cardiovascular poisons and asphyxiant. Under cerebral we have CNS depressant and CNS stimulants. So in CNS depressant we will learn about the CNS depressants. Okay, that is alcohol. Okay. So these are the other examples of all other poisons we have previously described in the classifications. Okay. So now, what is ethanol? Ethanol is an inebriant poison. Inebriant poisons are those poisons which produce lightheadedness, confusion, disorientation, drowsiness. Okay. Now, what are the other examples of inebriant poisons? The other examples are barbiturates, chloral hydrate, benzodiazepine, pyrrolidine, anesthetics, hydrocarbons, and formaldehyde. Okay, so these all are inebriant poisons. Now, first we have to learn about the various types of alcohol. What do we mean by absolute alcohol? Absolute alcohol is an alcohol which contains 99.9% alcohol, that is 0.05% water. Okay. What is rectified spirit? That is 90% alcohol. Okay. And what is denatured alcohol? Denatured alcohol is 95% alcohol and 5% wood naphtha. The wood naphtha is added to made it unfit for drinking. Okay. And what is proof spirit? It is an older term. It is defined as twice the percentage of alcoholic content of the drink. Some spirits are overproof, some spirits are underproof. Okay, and 1 unit of alcohol contains 8 gram of alcohol. Now we will discuss about what are the different types of alcoholic beverages. Now, the various types and their concentration are mentioned in the table. Vodka has 60 to 65 concentration of alcohol. Rum has 50 to 60% concentration of alcohol. Whiskey, gin, brandy, they have 40 to 45%. In beer, we have 4 to 8% of alcohol. Okay. Now, what is a standard drink? Okay. Now, 45 ml of distilled spirit, that is 15 gram of alcohol, is called as spirit. Okay. Another definition is 150 ml of wine. It contains 11 gram of alcohol. 350 ml of beer. It is 13 gram of alcohol. Okay. The alcohol consumption must not exceed 1 to 2 drinks per day. Okay. And the 200 gram per week of alcohol in men and 140 gram per week of alcohol in women is considered as safe limit if liver damage is to be avoided. Now we will learn about the mechanism of action of alcohol. Okay, alcohol is a well-known stimulant in a low concentration, but it mainly acts on CNS and it depresses it. Okay, the frontal lobes, they are more sensitive to low concentration, which results in mood changes, which is followed by occipital lobe, which leads to visual disturbances, and finally cerebellum, which leads to loss of coordination. Okay, in low concentration it causes depression of specialized and sensitive cells of cerebral cortex with release of their inhibitory tone and leading to unrestrained behavior. Okay, the depression of vital centers of midbrain and medulla, it causes coma and death. The relative concentration of alcohol at equilibrium in various body organs and blood are as follows. In whole blood, if the concentration is 1, then in plasma or serum it will be 1.12 to 1.2. Similarly, in urine it will be 1.33, and in alveolar air it will be 2300. And other organs and their relative concentration are written here, other fluids or organs. Okay. Now we will learn about the various stages of alcohol intoxication. Okay. The first stage is the stage of excitement. It occurs at the level of 50 to 150 milligram percent of blood alcohol concentration. In this, there is a state of euphoria, state of sense of well-being. It alters time and space perception. Okay, the person starts dancing. He even start disclosing secrets called as in vino veritas. That is, in wine there is truth. Increases desires for sex, but markedly poor performance resulting in prolonged intercourse with ejaculation. Okay. Now the second stage is the stage of incoordination. In this, it occurs at the blood alcohol concentration of 150 to 250 milligram percent. Okay, there is alteration in speech and fine finger movements, and also nausea, vomiting, flushing of face, and prolonged reaction time. Okay, this occurs in the stage of incoordination. And the third stage is the stage of coma, which occurs at concentration greater than 250 milligram percent. In this, there is dysarthria, that is, he is very thick and slurry speech. He develops hypothermia, amnesia, and diplopia. Okay, now at 30 milligram percent, it is the permissible legal limit for alcohol while driving in India. Okay, it is according to Motor Vehicle Amendment Act 1988. Okay, and the alcohol gaze nystagmus, it is a jerky movement in the direction of the gaze and independent of the position of head. Okay, it occurs at 40 to 100 milligram percent, and that is average is 80 milligram percent. It is not a constant sign. And the what is Mach-Evans sign? Pupils are contracted, but on stimulation they dilate. Okay, and with slow return. It occurs at 300 milligram percent of blood alcohol concentration. Now we will learn about the physiological effects of alcohol at various concentration. Okay, if the blood alcohol concentration is at 30 milligram percent, then there is impairment of cognitive function, motor coordination, and sensitive perception. Okay, and at 30 to 50 milligram percent, significant effect on judgment and motor control, and 50 to 100 milligram percent, decreased inhibition, attention span, slurring of speech, and alcohol gaze nystagmus. At 100 to 150 milligram percent, there is mental confusion, impaired memory, and emotional instability. At 150 to 300 milligram percent, there is loss of muscular coordination, staggering gait, marked mental confusion. And at 300 to 400 milligram percent, there is torpor, marked incoordination, and possibly coma. And at 400 milligram percent and above, there is anesthesia, respiratory failure, and death. Now, we will discuss about the few important points. The first is the micturition syncope. It usually occurs after heavy beer drinking. The person wakes up, go to micturate, and then suddenly fell unconscious. Okay, so this is called as micturition syncope. Another is the Munich beer heart. In this, there is cardiac dilatation and hypertrophy of heart due to excessive beer drinking. Okay, the third is the holiday heart syndrome. In this, there is cardiac dysarrhythmia after a heavy drinking episode. Another is a Zeev syndrome. It is also called as acute alcohol hepatitis. It is a triad of transient hemolytic anemia, cholestatic jaundice, and hyperlipidemia, and the patient presents with right upper quadrant pain and fever. Okay, there is also a Malanby effect. That is when the effect of alcohol are more pronounced when blood alcohol levels are rising instead of they are at peak or plateau or falling. Okay, and section 85 of IPC, what does it suggest? That act of person incapable of judgment by reason of intoxication caused against his will. That is, the person will not be committed of a crime which he has done under the intoxication of alcohol or any other drug like that, which is not taken by his will. Okay, so this is the section 85 of IPC. And what is section 510 of IPC? It describes the misconduct of drunken person in public in India, which is punishable. Okay, up to imprisonment up to 24 hours. Now, what is drunkenness? Drunkenness is a condition which is produced in a person who has taken alcohol in a quantity which is sufficient to cause him to lose control to such extent that he is unable to execute safely the occupation in which he was engaged at that particular time. Okay, so that is called as drunkenness. Okay, the various terminology used for drunkenness are, that is, when the alcohol concentration is below 10 milligram percent, the person is called as sober. If it is at 10 milligram percent, then it is drinking. And at 80 to 150 milligram percent, it is called as under the influence. And at 150 to 300 milligram percent, it is called as intoxicated or drunk. Okay. So we will discuss about the collection and preservation of sample for determination of alcohol in various samples. Okay. For blood, skin must not be cleaned with spirit because it will change the test results. Okay, it should be cleaned with 1:1000 mercury chloride or washed with soap and water. Okay, and preservative used is 100 milligram of sodium fluoride, which acts as enzyme inhibitor, and 30 milligram of potassium oxalate, which acts as anticoagulant for 10 milliliter of blood, and which is followed by thorough shaking. Okay, and for urine, two samples of urine are required. First sample should be collected as soon as possible, and second sample should be collected after 25 to 30 minutes. Okay, the concentration in second sample, it reflects the blood alcohol level during interspecimen interval. Multiplication of alcohol concentration in second urine specimen by 0.75 give approx value of blood alcohol level, because we know that concentration of alcohol in the urine is 1.3 times greater than the concentration levels of alcohol in blood. Okay, and the preservative used in urine is phenyl mercuric nitrate or sodium azide or thiamol. The various standardized field impairment tests for drunkenness are: this test is when the person has to stand with eyes closed, and if he sways to one side, then the test is positive. It is called as Romberg's test. Okay, in this test the patient is asked with closed eyes to touch the finger through his nose alternatively with the left and right hand. Okay, this test is known as finger nose test. Okay, and the third test is the patient is asked to stand on the one feet, okay, other feet being 5 to 6 inches above the ground. Okay, if the person sways, then the test is positive. This is called as one leg stand test. And the another test is the walk and turn test. Okay, the patient is asked to walk on a straight line, imaginary or real, okay, and then turn. Okay, if the person is able to do that, then he is not drunk. So these are the various standardized field impairment tests for detection of drunkenness. The various lab investigation for detection of alcohol can be classified into two methods. The first is the macro method, which uses 1 to 2 milliliter of specimen. Okay, the example is Kozelka and Hein test, and the another is the micro method, which uses only 0.1 to 0.2 milliliter of specimen. The example is Kavik test. Okay, both these tests depend on the reduction of dichromate or sulfuric acid by the alcohol vapor. Okay. Now, Widmark developed a formula to estimate the blood alcohol level, where the formula is A is equals to CPR. Okay, where A stands for the weight of alcohol in gram in the body, P stands for the body weight of person in kilogram, and C stands for concentration of alcohol in blood in milligram per kilogram, and R is a constant which is 0.68 for men and 0.55 for women. And for urine analysis, the formula is modified as A is equals to 3 by 4 QPR, where Q is alcohol concentration in urine, which is gram per liter. Okay. For medico-legal purpose, gas liquid chromatography is the most reliable method. Okay. For this test to be done, 1 ml of unknown solution is taken and 1 milliliter of acetic acid is added with 1 drop of sulfuric acid, and this mixture is heated for 1 minute. If there is strong fruity odor, then the test is positive. Okay. The various breath analyzers which are used for detection of alcohol in breath are also used. The principle behind is that alcohol absorbs radiation in the infrared region. Okay. The concentration of alcohol in deep lung air to blood is 2300 raised to 1. Okay. Legally admissible as per section 185 of Motor Vehicle Act 1988. The test of breath analyzers. According to Motor Vehicle Amendment Act 2019, which was recently passed, okay, first offense for drunk driving, there is punishment of imprisonment up to 6 months with or without fine up to 10,000 rupees. Okay, and in second offense, imprisonment of 2 years with or without fine up to 15,000 rupees. There can be arrest without warrant, a breath test and the lab test can also be carried out. Okay. Now, consent for examination of a drunk person can be examined without consent if requested by sub-inspector of police. Okay. Now, treatment. For acute intoxication, 1 liter of normal saline plus 10% glucose per 100 milligram thiamine plus 15 units of insulin is given. Okay. For chronic addiction, disulfiram, that is Antardict or Asperal, it is given as single dose daily for 250 mg. It inhibits aldehyde dehydrogenase. The second is the antabuse, that is tetraethylthiurium thisulfide. It inhibits biotransformation of ethanol beyond acetaldehyde stage. It leads to accumulation of acetaldehyde in blood and tissues, which causes unpleasant symptoms like flushing, palpitation, anxiety, sweating, headache, abdominal cramps, nausea, vomiting, due to which patient dislikes alcohol and will are not able to drink the alcohol. Okay. Third is citrated calcium carbamide, also known as temposil, which is also used in the as a dose of 50 milligram once a day. Okay, it has less side effects compared to disulfiram and antabuse. Now we will discuss about the alcohol withdrawal. Okay, the symptoms appear in 12 to 48 hours after last drink. Okay, most common symptoms are the tremors or shake due to overexcitation of CNS. Anti-craving agents are acamprosate, naltrexone, fluoxetine, etc. Okay. Now the first is the delirium tremens. Okay, it begins 3 to 5 days after their last drink. Okay, it is a sudden acute attack of insanity in which the main symptoms are coarse muscular tremors of face, tongue, hand. There is insomnia, restlessness, loss of memory, confusion, disorientation, tendency to commit suicide, homicide or violent assault associated with visual or auditory hallucinations. Okay, it is considered as unsoundedness of mind and not intoxication. So the person is not responsible for any act as per section 84 of IPC or McNaughton's rule. Now the another disease is the Vernicasencephalopathy, which is due to alcohol withdrawal. Okay, it is an acute reaction of severe thiamine deficiency due to heavy drinking. Pathologically, there is neuronal degeneration seen in thalamus, hypothalamus and midbrain, and this is associated with Korsakoff psychosis. Okay, so it is also called as Wernicke-Korsakoff syndrome. Okay, it presents as organic amnestic syndrome characterized by inability to learn new information, impairment of anterograde or retrograde memory, and compensatory confabulation. Okay, the treatment is the diazepam is given 40 to 80 milligram per day, or chlordiazepoxide is given 80 to 120 milligram per day. Haloperidol may be given at 20 milligram per day, but sometimes all these things does not work and the restoration of alcoholic drink is the only choice. Other diseases associated with alcohol withdrawal are alcoholic paranoia, alcoholic seizures, also known as rum fits, cardiac dysrhythmias, we heard earlier like holiday heart syndrome, Marcia-Fava-Bignami syndrome. It is a rare disorder with widespread demyelination of corpus callosum, optic tracts and cerebellar peduncles. Mallory-Weiss syndrome, there is tear in esophagus. Okay, so these are all the